Hi, I'm Dr. Brian Thornburg, and this is part 4 of your baby's developing immune system. When we give a vaccine, what we're doing is we're activating the Th2 side of the immune system, which are the antibodies. These are the memory cells, because we want memory cells to remember that virus or that bacteria. So the next time that we see that bug, we can mount a faster immune response by having antibodies on the ready. Now, remember, antibodies are like archers, and they're specifically targeted toward something specific. So that's why if I've had chickenpox in the past and one of my kids comes home and they now have chickenpox, I do not develop chickenpox because I have that Th2 side of my immune system. I have the memory cells. I am able to mount a very fast antibody response to the chickenpox. The chickenpox is definitely entering my body, but I'm able to mount a very fast response so I don't get sick, unlike my child who's naive to chickenpox. So it takes much longer for their antibodies to develop, and so they have the full-blown course. That's the difference between having been primed to a disease and not primed, and then that's the concept behind vaccines. So when we give a vaccine, what we want to do is we want to activate the archers. We want to activate the antibodies. We want to activate the Th2 side. And remember, when we give vaccines, we start at birth, and then they're followed up at 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months. Then there's a pause after the 18-month well-child check until 4 years old because of the excitatory nervous system. As that Th1 and Th2 starts to self-regulate, that can have spillover to the nervous system, and the nervous system is hyperexcitatory. The immune system is hyperexcitatory, and then we end up with febrile seizures. When we administer the vaccine, we're activating the Th2 side. The baby's Th2 system is overdeveloped during that whole time until about 3 to 5 years old. When we administer the vaccine, we're increasing the disproportionate nature between the Th1 and Th2. What we are designed to do without vaccines, if we were living 100 years ago before there were vaccines, by encountering our external environment with cats, dogs, dirt, viruses, bacteria, our mother's skin, our father's skin, the foods we eat, we teach our immune system how to balance, and that picks up the Th1. But now that we're given these vaccines, starting birth 2, 4, 6, 9, 12, 15, 18 months old, before the Th1 system has had a chance to fully develop, and we're further pushing up the Th2 side on the immune system by administering these vaccines, especially if the vaccine contains an adjuvant called aluminum.